There are many ventilator modes to help patients breathe. PRVC is a great mode of ventilation to manage and treat patients on a mechanical ventilator. So let's look at pressure-regulated volume control and see what sets this mode apart. PRVC is similar to other volume control modes such as assist control. For example, if the patient does not trigger a breath, the patient will receive a set controlled tidal volume. But there are some differences as well that sets this mode apart. First, let's look at the alarm feature. Let's say, for example, you set the high pressure alarm to 40. In other modes, this alarm would normally sound only when the PIP reaches 40. But in PRVC, the ventilator will alert you when the PIP gets 5 below the set alarm. In this example, when the PIP reaches 35. It does this to alert you that the pressure is increasing. It's trying to keep the pressure regulated. And if another breath is given and the PIP is 40, the ventilator will stop delivering volume and automatically switch to exhalation. And it will not deliver the entire volume because it would rather protect the lung from too high of a pressure. But there's two other unique features as well. Next is the flow pattern. Compare this pattern with a traditional square pattern. In a typical volume control, the operator has to set a flow. For example, the operator might set a flow of 60 liters per minute. With a traditional square waveform, this means that when a patient starts their inhalation here, the breath will start at a high speed here. Then, as the patient continues to inhale, they do not slow down their speed. They will maintain the fast, constant speed for the entire inhalation. You can try that now. As soon as you're ready to inhale, begin with a fast speed and keep it constant. Do not slow down or speed up as you inhale. Normally, this type of fast, constant inhalation creates a higher PIP than in the PRVC mode. But in PRVC, the waveform looks like this. That means that when a patient begins inhalation, they start fast, but their speed decreases as they inhale. This is actually more comfortable and it produces a much lower PIP. And the flow is automatically set and adjusted by the ventilator, not the respiratory therapist. So in a side-by-side comparison with the same settings, you'll notice that the PIP was actually lower in the PRVC mode. So how does the ventilator know how to adjust the flow on its own? Well, the ventilator will look at the last 3 delivered breaths, and it will calculate and determine if it can deliver a lower and safer pressure by adjusting automatically the flow. So let's recap. PRVC is similar to assist control because it delivers a set tidal volume. However, the unique high pressure alarm will help regulate the PIP. Also, the flow pattern is decelerating and automatically adjusted by the ventilator, not the RT. Plus, the ventilator looks at the last 3 breaths and analyzes whether or not it can deliver the next breath with a safer, lower PIP. In PRVC, it's all about regulating the pressure so that you can safely protect the lung.